As you may have seen today, or I think I mentioned, the governor has convened a coronavirus response team that's made up of about a dozen agency heads of either agencies that have a significant role in dealing with the event or may have a significant population at risk, corrections, youth authority, that kind of thing. That body is created to basically advise the governor on those kinds of decisions. We meet right now weekly. We can certainly increase the pace of that as circumstances dictate. And what I would expect is if we get to a place where, unlike circumstances like H1N1, we get to where the prevalence of the disease is outstripping our resources and our use of the usual tools to fight that group would take up the issue of whether the governor should declare an emergency, make a recommendation. We would be all over the place here, making you aware of the decision-making process and what's going on in that. And then if we got to the place of declaring a public health emergency, our communication would be truly robust across a variety of channels to make people aware of that and the specific actions being taken. Anything we need to add to that?
I would just say the crisis care guidelines you reference are really some tools we have for working with our healthcare partners to try and make sure that we can increase the capacity within the system during a crisis. Some of the efforts for social distancing and other things you reference aren't in those crisis care guidelines. They're in a separate document. We have a high impact pathogen plan of operations, the HIPPO, which are outline some of the public health tools that Director Allen mentioned about social distancing, cancellation of events, closures of schools or other large gatherings, if it rises to that occasion. And we come back to you and the governor to say that we think that implementing those solutions would be helpful in controlling the spread of disease. So we do have those outlined in another document.
And if I could just make a comment on school closures, because I know that's been in the news with the decision Japan made recently. Most folks, I think, don't know. We close schools for health reasons every single year. An individual school may close for a period of time due to norovirus or influenza, and that's a decision that gets made in consultation with the local public health authority and local school district, and that's done without there being a public health emergency or anything like that. And in a circumstance like this, we could certainly, that would be our first line of dealing with issues at the school level. We would need to get very far down the path before we would do some of the broad things that we've seen recently out of Japan.
Yeah.